Question 21. Which of the following is the most likely diagnosis? And we have another one of everybody's favorites. Oncology, the blood cancers. Everybody sucks at these. Some of them are pretty simple to get through. We're going to try to use logic to get through this one. A 7-year-old boy is brought to the clinic with 2 weeks of fatigue, intermittent fevers, and bone pain. So that's your classic layup for the cancers, especially in a child. This is very strange. His parents say he's been unusually bruised and has had nosebleeds. On exam, he appears pale, petechiae on his legs, no hepatosplenomegaly is noted. Okay, so this is important. The nosebleeds, right? So we're bleeding, and the intermittent fevers, bone pain. Thinking blood cancers, it's whatever cell type is proliferating unnecessarily, probably causing that bone pain. The nosebleeds, maybe we are thrombocytopenic. Oh, look at that. So that checks out. Same thing with the petechiae. It's the same cause for that. So we are thrombocytopenic. We are anemic with thrombocytosis. So, okay, obviously then this is our type of cancer. I'm not thinking polycythemia, I'm not thinking thrombocytosis, right? It's white blood cell. Then they give us the special stuff. These are the differentiating factors here, the peripheral smear and the bone marrow. So blasts, too many to count. And then over 25% lymphoid precursors. That's really important. And of course, also really important when you're thinking about blood cancers is the age of your patient. So we got a 7-year-old. All right, let's see if there's anything we can cross off. I mean, if you see this and you just know nothing about blood cancers, you are going to get rocked. Let's try and correct that. Leukemoid reaction. This is like it sounds. It's a reaction, not a cancer. All the others are types of leukemia. So what's the difference? Leukemoid reaction is a process that is reactive typically to an infection. So maybe you get an infection and the body overreacts and creates a ton of white blood cells in response. Not cancer, it's just an overreaction. And specifically, leukemoid reaction tends to be neutrophils. Okay, so leukemoid reaction is out because they technically don't mention neutrophils, they just say blasts. But if we take a look at the bone marrow, it's lymphoid precursors. Neutrophils are myeloid in origin. That's why I'm a doctor. All right, next up. This is my approach to these types of questions. Acute versus chronic. Chronic tends to be mature cell lines. So I wrote it out here. Acute tends to mean immature cell lines. Think blasts. Chronic are mature cell lines. So sites, no more blasts, they're sites, lymphocytes as opposed to lymphoblasts. If you knew that alone, you could probably feel pretty confident crossing off B and C. Next up, are we talking about myeloid leukemia or a lymphoblastic leukemia? Well, they both could cause blasts, but they would be called myeloblasts in that case. So this was left a little vague. However, the hint is in the bone marrow. It's lymphoid precursor, another name for lymphoblasts. So the correct answer is D. And one more thing for you. ALL, this is going to be a little mnemonic. ALL most commonly presents in children. And this is the only leukemia that most commonly presents in children, as far as everything that's in this in these answer choices here. Really exciting mnemonic. You can tell it to all your friends. I'm sure they'll love it. Is that all children get leukemia. Trust me, they're going to love it. Another mnemonic you could say is all children get all, right? But I don't know. I think all children get leukemia is just way more fun. Not for the children.